Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll discuss about the neurological assessment. So first we'll discuss about the consciousness and the cognition. So first is mental status. So in this, observing the patient appearance and behavior, noting dress, grooming and personal hygiene. Posture, gestures, movement and facial expression often provide important information about the patient. Assessing orientation to time, place and person. Assessment of immediate remote memory is also important. So for immediate memory, ask the patient to repeat 6-digit word and backward. For recent memory, ask about what was the breakfast or the dinner. And for the remote memory test, ask about the birthday and or any childhood memories. Second is intellectual function. A person with an average IQ can repeat 7 digits without flattering and can recite 5 digits backward. So examiner might ask the patient to count backward from 100 or to subtract 7 from 100, then 7 from that and so forth, called as serial 7s. So the capacity to interpret well-known proverb test abstract reasoning, which is higher intellectual function. For example, does the patient know what is meant by a stitch in time saves 9? To assess intellectual capacity. For example, how are a mouse and dog or pen and pencil alike? So can the patient make judgment about situations? For example, if the patient arrive home without a house key, what alternatives are there? So third is thought content. So in this, during patient interview, ask about are the patient thoughts spontaneous, neutral, clear, relevant and coherent. So does the patient have any fixed ideas, illusions or preoccupations? What are his or her insights into these thoughts? Preoccupation with death or morbid events, hallucination and paranoid ideations are example of unusual thoughts or perceptions that require further evaluation. Fourth is emotional status. Is the patient's affects external manifestation of mood, natural and even, or irritable and angry, anxious, apathetic or flat or euphoric? Does his or her mood fluctuate normally, or does the patient unpredictably swing from joy to sadness during the interview? Is affect appropriate to words and thought content? Are verbal communication consistent with non-verbal clues? Fifth is language ability. The person with normal neurological function can understand and communicate in spoken and written language. Does the patient answer questions appropriately? Can he or she read a sentence from newspaper and explains its meaning? Can the patient write his or her name or a copy a simple figure that the examiner has drawn? A deficiency in language function is called as aphasia. Sixth is impact or lifestyle. The patient roles in society, including family and community roles, will be asked by doctor to the patient. Seventh is the level of consciousness. So for consciousness check, ask the patient about the patient wakefulness and ability to respond to the environment. Level of consciousness is the most sensitive indicator of neurological function. So to assess level of consciousness, the examiner observe for alertness and ability to follow commands. So for level of consciousness, the most common scale used is Glasgow scale, which is known as GCS. Thank you.